Good morning, everyone. Grade 11 and 12. Today we will start the revision. I'll start with the infectious disease. It's going to be light and simple, and since we have done this several times. Okay, when we're going to study the infectious disease, what are the important things that you need to know? First of all, what is an infectious disease? Infectious disease is like corona these days. Anything that causes you illness by a microorganism, whether it's a virus, a bacteria, a fungi, and sort of like gives you like symptoms and signs. Okay then, this infectious disease, what does it differ from a non-infectious disease? The infectious disease is like, it can be transmitted like from one person to another. So here, a disease in general is actually an illness or a disorder of the body or mind that leads to poor health. Each disease is associated with a set of signs and symptoms. Like, for an example, when you get a common cold and flu, you will start having something that really tells you that you are ill. Fever, could be a cough, could be like a runny nose. It could be like a lot of things. But the infectious disease here is actually a disease that can be transmitted. It's caused mainly by a pathogen. That means a microorganism that causes the disease. As they are passed from the infected person to the uninfected, reducing the effectiveness of functions. Okay, the non-infectious disease, which are diseases that are not caused by a pathogen. This is the difference. And they can be either cardiovascular, that means a disease related to the heart or the circulatory system. Example, it could be like lung cancer, or inherited or genetic sickle cell anemia for perhaps, or a deficiency, a lack disease, like for an example, malnutrition or mental disease. Okay? Okay, so these are actually infectious disease. We will have like several sort of microorganisms or diseases caused by microorganisms. For an instance, we have here the cholera. The cholera here, to make it much easier for you, follow the strict way that we had, like each disease is caused by which sort of microorganism, the incubation period, the symptoms and signs, how do we treat it, and all those things. For here, the cholera is a waterborne disease that occurs where people do not have access to proper sanitation, a clean water supply, or uncontaminated food. Okay, the cholera here, it's more likely sort of a disease that actually affects the respiratory system. But where does it come from? Or what are the signs and symptoms? The cholera here, it's like it comes when people, could be like povert sort of people, they live in like unclean places because they don't have access to clean water, or they don't eat like clean food. So practically, they would have like excessive diarrhea. If it's not treated, it would be leading to dehydration and then death. The pathogen here is Fibrochloria, and the organism is actually a bacteria. The transmission here could be from foodborne, waterborne, and fecal oral route. The incubation period is 2 hours to 5 days. The site of action is in the small intestine, and the symptoms is severe diarrhea, loss of water, and salts, which practically leads to dehydration. Okay, since we have dehydration, what is the cure? How do I cure this person or this patient? Treating cholera, the major thing that I need to focus about is dehydration, so I have to rehydrate. Oral rehydration therapy by means drinking a solution of glucose and salts to rehydrate the body. Whatever the body lost, we have to regain it back again. Preventing cholera. Another thing that it's a major cause of the cholera is actually not being able to access clean water, and the sewage is actually mixed with the water to make it more worse. So how do I prevent the cholera? I would actually have like companies or any sort of authority to have the sewage treated. and also a provision of clean water pipes that is chlorinated to kill bacteria. That's why we add chlorine to the water in order to kill the bacteria. Now we come to another disease which is called malaria. The malaria here is caused by a Plasmodium parasite. Here I want to remind you that the cause of malaria is a parasite, but the mosquito is only a carrier. Please don't forget that. Don't put the mosquito is the main cause of malaria. No, the mosquito, the female Anopheles mosquito, is actually just a carrier for the disease. Meanwhile, the parasite that lays inside of the guts of the mosquito is responsible for you to get malaria. Okay? So malaria is caused by a Plasmodium parasite. The parasites are spread through the bites of infected female Anopheles mosquito. Okay, the pathogens here, we've got several ones, but I just want you to focus about the Plasmodium parasite as an overall. The organism transmission. The organism here is a protocyst. The transmission here is by the female Anopheles mosquito. The incubation is 1 week to 1 year. The site of action is the liver and red blood cells and the brain. That's why people actually die from malaria. The symptoms here, you will have fever, nausea, that means you feel like you want to vomit or puke. You will have headache, sweating and spleen enlargement. Also muscle pain, you will feel fatigue. Okay, the treatment of malaria. Since it's malaria, you're just going to use anti-malaria drugs to treat the infected by inhibiting the protein synthesis. That means decreasing the protein synthesis and sexual reproduction. Therefore, thus preventing the parasite spreading within the body. Preventing malaria. How do I actually prevent malaria? By reducing the number of mosquitoes, by killing it or spreading oil in breeding grounds, draining marshes and clearing vegetation. Or avoid being bitten by a mosquito by sleeping under mosquito nets, especially those who actually tend to go to the moisturized specific countries, those who have high humidity like tropical areas in the middle of Africa, all sort of like those kind of jungles. And so use drugs to prevent parasite infecting people. The biological control is stocking bodies of water with fish which feed on mosquito larvae and spraying bacterium that kills the larvae. Controlling malaria. Okay, increase public knowledge about malaria. That means you have to educate people. You have to tell them what is malaria, how does it transfer from one person to another, or practically from where the person does it, how does he get it. Also, increase accessibility of healthcare in rural areas and diagnose infected people so treatments can start a bit earlier. Use of modern techniques in gene sequences and drug design. Also, development of vaccines target against different stages of the parasite life cycle. Okay. Okay, factors affecting the worldwide distribution. Almost 90% of cases of malaria are reported in sub-Saharan Africa. Malaria is abundant in hot and humid places. That's why I told you those who actually tend to go to tropical zones should take previous precautions. The Plasmodium parasite require temperature higher than 20 and no mosquito control programs. Also, increased use of DDT, causing DDT resistance Anopheles species. Okay. The acquired immune deficiency syndrome, which is HIV pathogens infect and destroy the T helper cell of the immune system, thus it does not respond adequately to infection. When I'm talking about the HIV and the acquired immune deficiency syndrome, the AIDS, as we all know that the main pathogen here is actually a virus, and the routes that how they actually transmit from one person to another is very, very not just important, but rather like you need to take previous precautions about that. Because when I mentioned it before in our class, is that the transmission here, it's like you always have to make sure you use your own personal things, whether it's your underwear, whether it's like your personal clothes, boys like for shaving tools, you know, those kind of things. And also those who actually like go through a drug sort of treatment, make sure no one uses your needle and you don't use anyone's needle. Even if you got scratched, try to like just apply a plaster or something and avoid like, you know, getting through and you know, touching other surfaces. Okay, the pathogen here is a virus. It's a retro sort of virus. The transmission, exchange of body fluids during sexual intercourse, intravenous needle sharing, blood transfusion as well can be very dangerous. Plus, also the pregnant sort of a woman, if she's like a carrier or she has the virus, therefore, although her child or fetus or baby could actually be affected, whether she's like breastfeeding or while the baby's still in her tummy. The incubation period, the initial incubation period, it starts from weeks, but still like it takes up until it shows like even to 10 years. Imagine that a person will be a carrier for the HIV or the AIDS. 10 years he's living like a normal person, and he doesn't even know that he has it. So we have to take a major care from that side. The site of the action, we've got the T helper lymphocyte, the macrophage, and the brain cells. The symptoms here, it's like you will have pneumonia, you will have tuberculosis and cancers, like those kind of people, they are more susceptible to have them. But like the major signs where you can notice like in just a short period of time, you will lose weight. And it's like, no, you didn't go on a diet, you didn't do that sort of like diet plan. No, you actually lost weight suddenly. And also you will have diarrhea, fever, sweating, and dementia, not able to sleep. Okay, how do I treat the HIV? There is actually, unfortunately, no cure. However, drug therapy prevents replication of the virus. That means the virus cannot be replicated, cannot be doubled, prolonging life. It binds to the viral enzyme reverse transcriptase and blocks its action. How do I prevent the HIV? Has an antigenic shift, thus difficult to recognize and control, but education about the spread of infection would actually do the thing. Use of condoms and feldoms as they form a barrier between body fluids, contract tracing using to identify and isolate the sources of infection by testing for the HIV antibodies, used to isolate and treat more people and prevent further spread of the infection. Stop sharing needles, or actually use the sterile. Sterile, that means they were actually like brand new or disposable. That means you only use it for once. The blood should be HIV screened and heat treated to kill any virus. If tested positive for HIV, then you should be given medical drugs and psychologically supported. Okay, now we go through the tuberculosis. The tuberculosis here, it's an incredibly invasive disease. We had it once before, like around 20 to 30 years ago. It often strikes the HIV positive people and those who are suffering from malnutrition, as their immune system is very, very weak. The pathogen here is mycobacteria. So the pathogen is a bacteria. The transmission is also by airborne droplets. Those who like eat undercooked meat and they drink like milk straight forward from the cow with no pasteurization. So the incubation period here is like from few weeks to several years. The site of the action or the infection, where is in the lungs. Why? Because majorly is in the lungs. Tuberculosis, that means one of the worst case scenarios is that you start coughing blood. That's why for tuberculosis, for cholera, and for lung cancer, when you go to the hospital, you will be differentiated or diagnosed, DT we call it in medical field. DT, the differential diagnosis, that means there's a possibility, if not cholera, tuberculosis, if not tuberculosis, it's probably lung cancer. So this is how, because they've got like similar sort of symptoms. The symptoms here: coughing up blood, shortness of breath, fever, chest pain, swelling, and weight loss. How do you treat the tuberculosis? Samples of sputum, that means the mucus and the pus that you have inside of the bronchus or bronchioles or inside of your lungs, are collected, and the TB bacteria is identified by microscopy. The infected patients are isolated and treated by drugs, and patients should take their full course of drugs, otherwise they will harbor drug resistance bacteria. Okay, here we go to the immune system, I believe. This one's about tricky. Yes, the immune system. What is an immune system, and what is the immunity as an overall? The immune system here is like something that really affects your body. Whenever there's like a foreign body or anything that just enters your body, you will start, or your body will start reacting upon it. So when your body actually starts to react upon it, you will here have many sort of reactions going on, or many sort of responses. I'll be explaining that in the upcoming video, inshallah.